Hello, dear mental growth community. And today we have a special guest and a special podcast. Today we will discuss XR technology, which is VR and AR and some different immersive level of engagement. And we will talk about it from the position of healthcare. And today I invited our guest, Jose Ferrar Costa. He is medical doctor, and as well he is doing innovation projects in Badalona Serveis Assistencial. One of his projects is also connected to VR, and he's exploring this topic not first year. So welcome, Jose. Please tell us a bit brief your connection to XR technology and how did you come to it?
Hello everyone. Thank you for having me here. Yeah, well, my relationship with VR started in 2019. First, it was just as a user, but then I started learning how to develop the content for VR myself, first as a hobby. And then when I saw the potential of VR for medical healthcare and for education, I decided to start trying to bring it into our work. My work, I work in a public healthcare system institution. So having innovation with technology is not so easy. Having someone bringing it as a developer makes it much more feasible. So back in 2021 was when I actually started uh, managing and creating projects with XR in healthcare.
Can you tell more about your projects last years? What have you done? Maybe you have something too proud that you want to share. Tell us more about your projects.
Well, the first project in 2021 was a project focusing on trying to reduce the burnout of healthcare professionals. So the users, the participants were the actual professionals, which made it very interesting because it was not only successful in reducing the burnout by teaching them new techniques, mindfulness and emotion management techniques in VR, in this educational program in VR, but because the users were the actual professionals, they came back to me after using VR with ideas of how to use VR for their own patients. And that's why we have a lot of projects now, because it came directly from the final users with specific needs where VR could help them to provide a better care for their patients.
And what are you doing right now? You have something you want to share, maybe some specific research, or you work with a disease. Just maybe someone of our listeners, of our followers would like to follow you and to know more about your project or even to join it.
Yes, at the moment we have quite a few projects inactive. For instance, the biggest lines of project, we divide our projects in three lines mostly. Is the educational line. The education can be for the professionals, for teaching or training emergencies or social interaction, communication skills and soft skills, or it can be for the patients, like teaching them new techniques to manage chronic diseases, or how the journey, the day of the admission in the hospital is going to be, so they know where to go and how to prepare themselves for interventions. The other line is the relaxation, which can be used for also both the professionals or the patients during interventions or before surgery. And the third line is the actual therapeutic use. For instance, we use VR doing a multidisciplinary project in primary care to help managing chronic pain. So these patients, the group of patients are following these 8 sessions or 10 sessions with the physiotherapist, the psychologist, and the medical doctor to teach new techniques for managing the psychological part and the physical part of the chronic pain. So we are treating this sometimes the phobia or the fear of movement because they expect to feel pain. And if you use VR to train some types of exercises that are supervised by the physiotherapist, they can learn that they can actually move without focusing the attention on pain. So it's treating the kinesiophobia, which is the fear of pain. Or for another use for therapeutic is the cognitive rehabilitation, when we use VR for exercise for memory and attention in seniors with memory and attention impairment. So it's enhancing the therapy.
Yes, it's very interesting. We also plan soon to make an online conference about discussing how can you use VR in treatment of phobia. So if you're interested, we can also invite you. But
Yeah,
let's
that's
go
great.
deeper in this topic because we start to discuss about different like XR, VR, AR. I know that maybe for some people it's very clear what is it, but still I would like to ask you to say a short description of this technology, what is the difference between them,
Hmm.
and how exactly each of them are used in healthcare nowadays.
Yeah, it's interesting because it's not a new technology, but it's still new for a lot of people. So people get very confused with the names because we hear a lot about virtual reality, augmented reality, and mixed reality, right? So there is a little bit of mixed up sometimes, and they are slightly different. With virtual reality, when you put on a headset, you completely uh, transport yourself to a new reality. So you're not seeing the conventional reality anymore. You're not seeing where you are anymore, and you are in a new world. So it's very good for interaction. It's very good for education because you have the attention in that new environment. But for instance, if you have a group of patients doing exercise, you don't want them to to hit the wall or each other. So in that case, augmented reality or mixed reality would be better because in this modality of immersive technology, you can still see the environment where you are with the cameras, the cameras on the in front of the headsets. You can see the environments, but you are adding something to this reality, this conventional reality. You can add games, you can add objects that you can interact. So it's in this case it would be mixed reality if they interact with the conventional or the real environment, and it would be augmented if it's just superposed to the reality. And another difference is you can use immersive technologies in two ways. With the headset, it's very clear, everyone knows about it, but you can also use a projector to put on an empty room on the walls and project the digital content. And we do have that also in our intermediate care center. It's a sensory room that we use this specific projector from this company that's called Brumix. And you can see on three empty walls interactive components or videos, 360, in this case, 180 degrees videos, and you can use it to relaxation, to education, or to even to make exercises with the patients if you want to guide the session. And it's very useful for patients like seniors that are having dementia or are nervous or are not capable to use of using the headsets or because of any reason, so they can still use the immersive content in this type of environment.
Okay, and when we talk about XR, mm, can you tell can you highlight the greatest opportunity? How do you see this industry in the future? Like, if everything goes well, this will develop in healthcare. Can you share your dreams? Like, as a researcher, what do you dream for? How can it be used for?
It's getting more and more common to see projects in every hospital and medical centers with VR. And if you look at the data set of medical publications in journals, in really strong journals, not about VR, but about geriatrics or pain medicine, you can see more and more articles that has been published during the last decades about the use of XR in healthcare. So I see a great evolution in that side because not only we are learning how to use it in a better way with more safety and thinking about the ethics that are all involved in using VR with patients, but also how to how to not learn it, how to not use it. I mean, because if we're doing research, we learn the best way to use a new technology, and we also know now where it's not really useful.
And what are the key problems so far you met using VR?
Well, for healthcare, it's very specific if you use a new technology in healthcare in general. But one of the biggest in the public healthcare system, one of the biggest problem is the budget. We normally don't have budget for financing innovation projects, so it's very hard sometimes to find the right grant or donation to be able to implement these projects. Then we have also this resistance to technology that are very common in healthcare professionals. But it's not because they are afraid of technology, it's just because they are so busy and burnt out. They don't have time to learn something new when they have a lot of patients waiting to be seen. So this is very important. When you're doing something for healthcare professionals, we need them to be part of the team since day one and evaluate the need of this technology in the daily work. Otherwise, it will not be implemented or used. You can build an amazing app, an amazing game that's very nice, very well done. But if the end users that are already busy in their daily work are not part of the team since they start, they're not gonna use it in the end. They're gonna think it's a burden to learn something new, to do something they're already doing. So it's very important to
Is it
take heart.
connected to specific age of a medical professional, or did you notice this in general? They just are too burnout and using the new technology should be developed before in their like students' course. Nowadays, when they have full-on job, hard to implement anything new, yes?
Well, if you get the new generations, of course, they are more used to technology, but it's not only the age, because you can see young people that are really, really resistant to learning something new, independent of the technology, and people that are older and are keen to and open to give sometimes in learning these new techniques or tools or how to use these tools. So it's not only the age, but the previous experience with technology. Of course, if we're starting using a lot of VR and XR in medical universities and nurses universities. So of course, when they come from the medical school already learning in VR, they know the technology and they know the potential of this technology for the patients. So it's easier to implement with the residents, for instance.
And so far, you said there are some problems in fundraising process for VR projects. But still you somehow survive and already doing your work 20 years mostly, yes. So 15 years, how many? But still, how do you survive? Where do you get money at the end for VR projects?
Well, collaboration is key. More than the money itself, the collaboration with some companies that are open to and understanding that the public healthcare system is not really a best place to earn a lot of money. They do have very special conditions to let us use this technology. Sometimes we get donations from partners. Sometimes we get collaboration if a company wants to develop it to commercialize in the future, and we are part of the development team or the research project to develop the tool and to validate it in a clinical setting. So we in contraposition we get access to the tools, to the headsets, and to the app. So it's a win-win game in this part where they can afterwards they have the product to commercialize to other hospitals or private clinics.
And do you see any specific way how VR technologies or AR can be used in the way of really saving the time of the doctors? Like maybe you did some measurements, just not, to be abstract, because many people say any new technologies is a lifesaver, but when we go to some real numbers and implementation, there are some causes, yes. So in your vision, like maybe
Well,
you.
I think the educational part of the VR use is very important to. to helping the professionals to interact with the patient. For instance, let me give you an example. We have this project where we have this video of the whole journey of the patient the day of admission in the hospital before they go under surgery. So if they go to the pre-anesthesia visit some days or weeks before the surgery, the nurse has to spend like 10 or 15 minutes explaining the whole journey. But if instead of that, they can watch in real VR, in immersive content with 360-degree videos, the whole journey of the admission day with the admission, the surgery theater, and all the environments they're gonna be, and the clothes they're gonna wear, and all the steps they need to take that day. They see that before they go into the nurse room, so they know already the information. She just have to ask, "Do you have any doubts? Did you understand everything?" So it saves her a lot of time. And for other purposes, we also saving, maybe reducing medication. We are also saving money for the healthcare system, because for the chronic pain management project, because these patients, because they use a lot of medication for chronic pain, and they learning these new techniques how to manage chronic pain without the medication, like with mindfulness techniques, or how to make exercise in a proper way. And we are now getting to reduce the intake of medication that they do chronically.
And as for your experience, for example, imagine that there are some doctor, medical person, yes, or a nurse or whatever, any person from healthcare. He thinks that it will be interesting to learn how can I use VR or AR or XR or any technology in my work, in my research, in my medical practice. What can be his first step if he want to know more, if he want to start some collab?
Well, the first thing in when you want to use a new technology is to try it yourself. So I would recommend them to go somewhere or to visit a center, a medical center that is already using VR, to try the headset or the projector and see how it feels by themselves. And then they would understand how it works and the potential of this technology, and also to see how it fits in their daily work. Because of course, for some use cases, it can be positive. In other cases, it's just a burden and an extra job to set up the headsets and everything else. If you just want to give an explanation of a very specific technique, maybe you can use a 2D videos in a screen. You don't need the VR headset. So it's important to know the technology in first hand, and then you would understand where you can use it yourself.
Mhm. Thank you. And after a person will know this technology, he'll understand how to use, he can start doing some his own project, or for example, invite a technical team, yes, where he can go on and go on. There are some also VR companies that provide these services private, or again, you can collaborate with other healthcare providers. Okay.
Yes, well,
Uh,
the first
mhm.
after using it for in first hand, they have to make a bibliographic research in the literature and see what's being published in the same area or the use case they want to use VR, and then they would see if the results are positive or not, because then it makes it safer and ethic to start a project. And then, as you say, they can find the proper collaborations and the technical partners in the area.
And which VR devices do you use?
At the moment, we use mostly the Meta Quest, because mostly, of course, the price is something important for public healthcare system, and also because they are very good quality. Well, the hand tracking, it's very intuitive to interact with the virtual digital content, especially for patients. We don't want to use the hand controllers, because there are a lot of buttons, and it's much easier if they can have the hands free and just use them naturally. So the hand tracking is very good, and the quality of the graphics and the headsets is very good.
Mhm. And now, maybe if one of, I don't know, investors or potential founders of a project can watch our video and he thinks maybe he want to invest in your public fund, in your research. Maybe you can have a small pitch, a small short invitation.
Yeah, in that area, we are a little bit limited in this area because we are not commercializing anything that we're creating because we are a public healthcare system institution. So everything we are using, whether it's coming from a company that has the app already commercialized and we pay to use it, or we are creating something internal for in-house use, including it into a research project. That's the way we're doing it, because creating a new content for on an app in VR is very cost and time consuming, and we don't have the resources, nor we cannot even commercialize it in the future because it's not part of our institution line of work.
Yeah. But if you still want to sponsor, yes, you can contact.
Well, if they want to help us, of course, we are open to
Yeah.
receive any help and collaboration. We can also look into collaborative efforts through the research projects. It's always interesting, of course.
Mhm. And last question, few last question before we end. How about inclusivity and accessibility in patient care? Does XR technologies help in that?
It does, because, for instance, we have a project that is focusing on children and adolescents with neurodiversity, and this is interesting because sometimes the nurses want to teach them something like health nutrition, and it's not they are not able to really get the attention because they are not able to focus the attention with what on what they being told. If you use the technology, it's easier for them to understand um, the concepts that we want to explain. We can also use the immersive technology to teach about the medical procedures, and maybe in the future, not in our case, but there are projects that use VR for people that are in their homes and they cannot leave the house, or they live far away from the healthcare center, and they can use VR for medical consultations or psychological sessions because it's very immersive and they feel like they have someone near them talking to them, and it's more effective. So it's more inclusive in this case. And for accessibility, it's interesting because, of course, even people with very few resources, if they get in touch with collaborative research projects, they can be included and use the this technology. So it's getting more accessible, inclusive.
And how about the AI? Do you use anyhow AI in VR nowadays or in AR, or it's not yet common in this field?
It's getting more and more common in different medical areas. The AI with the VR or XR, it's getting mixed more and more. Also because you can use avatars that are connected to an AI to simulate situations to teach medical professionals how to deal with conflicts or how to give bad news. So these AI avatars, they are being used as virtual patients because it's very realistic. You can just talk and they would talk back. You don't have to push a button to decide what to say to them. And it's very intuitive and realistic. So you can really teach communication skills and solving problems and conflicts in this way. So for educational purpose, it's getting more and more common.
Interesting. Myself, I also did work in VR before. One of my first projects in the healthcare industry was connected to VR. I was working in Erasmus-based program, and we were doing a medical educational simulation for nurses. So the main project topic was to make a model inside the European Union-based nurses educational system. We had a big collapse between 6 universities. I was from the management team in TAMT. This is a German innovation and research academy who were leading the project. And there were different universities from Sweden, from Cyprus, from different countries. And we also, from the beginning, had this idea to work together,
Mm.
medical professional, didactics professional, and technical professional, and business professional, no, management professional. We all did work from the beginning. And it was very interesting experience because one of models we did was the simulation of training the patient. And it was really interesting how people reacted because from one point, the avatar in VR is not really natural, and you have this feeling of kind of playfulness because you not really feel it seriously. But other point, what was interesting for nurses that during the simulation of talk, we highlighted some topics and some kind of red, yellow, green flags where this is better you say, this is okay, but no so, depending. And what nurses say that at the beginning, they didn't felt seriously about this training. It was more like for fun. But after the time, they noticed that the brain itself remembered much faster everything that they did the similar in real life. Because they were less worrying, they were more open. The brain was more relaxed because of that. And same time, all the infographics, all this feeling of surrealism is kind of get grounded in the body.
Yeah.
And the effect, I went away out of the project before we finished, but I'm interested because we also tried to measure this feeling that if you work on the simulation in real life, which is done, for example, by other students or it is done by real patient, yes, which is no, you can't every day use them, yes.
Yeah.
And I believe that immersiveness of VR and ER, this is something people now really underestimate because in education now there is a big race. Who will be the first? Not in the
Mm.
way like to know best of best, but in the way, for example, to earn money. Like how many years do you need to study to know to earn money? For example, in medical field, you need to know specific framework, specific situations, how you should react in every situation. And the best way to train them is really using VR. So in my case, if we talk about medical educational business and medical market in general, this is super like important and needed topic there. And can you tell more about from your appearance, from your vision, how do you feel education in VR? Maybe you have some, again, measurements. Maybe you did some like
Yeah,
feedback.
you well, we're talking about here about the cognitive load, and the cognitive load is the amount of information you are inputting into someone that are learning something new. And of course, in VR, you have two, two, two lines here. Whether you can overdo it if you put too many information, too much, too much details, too many details in the environment, or it's too bright, or too many colors, or too much noise. That is going to be counterproductive. But if you do it properly and make people relax and make it like a game in this case, people are more relaxed and open to learn the techniques, so they are more keen, like you said. It's easier for them to focus on the and what they are saying on the situation, because they are not stressed, well, not too much stress as if it was a real case scenario. And that's how it works with the training and the education in VR. That's the beauty or the magic of VR, because you can really control all this input, all this amount of information that you can put on the environment, because you are completely isolated from the real environment. And also you are also focusing the attention there. You cannot be distracted by the window or by your mobile, because you cannot even see it. And for a specific public, like people with hypersensitive or autism, they cannot have too much bright lights or too many colors. So you can tone it down, you can make it proper and adapt it. and it makes it easier for them to use the content and to focus on what they need to learn. So I see a big future for VR and XR in medical education because of that. And also for the costs, sorry, also for the costs, because if you want to create a medical simulation with actors being patients, it's very time and money consuming. You have to organize it with all the material and the situation. But if you have all of that recorded in a digital content in a headset, you just bring the headset to any clinic, and the students can use it anywhere.
Yes, true. I can even also say that interesting, just to our listeners to know one thing. For example, also what we tried to do in our simulation, we one of modes was an exam mode. For example, nurse should learn specific procedure. And in VR, it's also very easy to get it tested because if you have actors and one space, you need to wait while everyone will finish, and it takes a lot of time. And in VR, in the same room with same person, 30 students can do in the same time if you have enough devices. And
Yes.
then during it, the students can train, but also students can be tested because it's very objective and very clear. If you forget to do something, for example, learning the procedure, it's your mistake and it affects your score, and so on. So in this case, VR also can become a testing or exam tool for professors to teach.
Yeah, that's another advantage of the VR, because you are at the same time there. It's like a game, and you're not stressed. But the system can be recording every step you take, specifically and objectively. So you know exactly afterward. You can have the feedback of what every step you took, every decision you made with the timing, and it makes you learn with every simulation. And even if you err in the simulation, you learn from your mistakes, because you can do it again and you're not harming anyone real before you learn the technique or how to communicate things.
Okay, and last question. Any inspiration for a potential VR student? Otherwise, it's a doctor who want to study VR or tech professional or someone who is only going to this immersive world. What will be your first words? What you can give some advices in this world?
Well, advice. If you're using VR for your colleagues, it's easier for education. But if you use it for patients, you have to start it gradually. Don't start with a patient doing a heavy simulation with a lot of information. You can start a project, even if the goal of the project is not relaxation. You can start the first session with a simple guided meditation. So the patients, especially if it's seniors or patients with any kind of hypersensitivity, they can start to get acquainted with the technology and feel comfortable. So they lose the fear of using the headsets. And then after that, you can start the physical therapy or the cognitive rehabilitation or the exercise, whatever you want to do. But I think it's important to go very gradually, because some people, if they have a first bad experience with the VR headset and they get uh, nervous or stressed, they won't want to use it again. So you lose a participant there. That's a good. I think it's a very useful advice.
Oh, yes, this is a whole invite because for me, because I was leading a VR team, for me was always a question when even medical professions that are paid for this work still have so much struggling in adapting to new device because in many ways it's all very important is first reaction and you should make this way smooth. Even it's like in games before old games they didn't have so like good onboarding process, but now new
Mm.
games that just arrived they have so smooth way that you like just play the game and then you don't notice how you learn inside the game. And this is very good, again because it's based on your brain development and how it grows, how it yes reacts. And you should consider this, of course, when you train people with new devices, especially innovative devices such
Mm,
as augmented reality or virtual reality. So
yes.
thank you so much, Jose. It was a nice podcast with you. I hope you inspire our healthcare professionals to use VR more because still it's an innovative field and we can't say it's like commonly used in every hospital, but it should be and it will be for sure. Just who will be these first players in the game, we will see. So thank you so much for your research and keep in touch.
Thank you. Thank you for the opportunity. Thank
Bye
you.
bye.
Bye.